Hello students, welcome to KENE'S Educare, a group of KENE solutions. This is part 4 of lesson number 13, Why Do We Fall Ill? Now, in the last 3 parts, we have discussed on the different reasons and the different terms that we use when we fall ill, right? When you fall ill, what do you say when you go and visit a doctor? That I'm facing, this is the sign that my body is giving me, and this is the symptoms that I'm showing, right? You say that these are the symptoms I'm showing, and now listening to your symptoms and looking after your symptom, the doctor is going to identify the sign, that this sign is of which disease, and that is the reason you like that is the reason that you knowing the signs which is occurring in your body is very much as important and essential as well, right? And as the lesson itself is stating, that what are we going to discuss here? We are going to discuss on why do we fall ill, the various reasons we are going to discuss on this lesson. Why are we falling ill? Okay, so up tak we have started discussing on health and diseases, we have started discussing on infectious disease and non-infectious disease, right? So we are going to do a quick revision on all the things that we have studied so far, and then we are going to start with today's topic. Okay, so see, the first thing that we started studying in this lesson is about the health and its failure. This is one of the most important topic, right? The health and its failure. Why we fail, like why do we fail with respect to our health and we get diseases? So the first topic that comes under this health and its failure is the significance of health. Okay, now health is nothing new to y'all. It's not like this is a new word that you have come across, right? Health is something that you use at various times when you don't want to go to school. You tell your mama, my health is not good today, I'm not feeling good today, right? Then when your grandma is not able, falling sick, okay, or she is not good enough to go out and move, you say that my grandma's health is not so good, right? So we have heard this word health and we use it even quite frequently, right? And when we use it for ourselves, when we say things like, my grandmother health is not good, right? And our teachers use it when they scold us saying, this is not a healthy attitude. Now here, the health, the difference between the health that we have used, healthy ka jo kya hai, that is someone different, right? So what does the word health exactly mean? If you think about it, you will realize that this health, it is always going to imply to the idea of being well. Now, it is not like that you're not having any disease. It doesn't mean that you're healthy, no. Because we have discussed on the definition on health, where it states that what is health? Health is a state of being well enough to function well physically, mentally, and socially. Okay, what is exactly health? A state where you are physically, mentally, and socially well. Okay, now what when your teacher is scolding you and saying that this is not a healthy attitude to follow. So if she is teaching a topic and you're not interested in that topic at all, so what are you doing? You're just chit chatting with your friends, you are sleeping in the class, though your teacher is teaching you, right? So you are doing something wrong, right? So that is the reason when teacher scolds you that this is not a healthy attitude towards study, because you are present in the school for studying, and if you are slipping and chit chatting with friends while your teacher is teaching, that is not a healthy attitude to follow. And when the teacher, instead of teaching, if she is not teaching you all and she's telling you to write that, to write this, she's not teaching at all, so at that time, that is not a healthy attitude for teacher. Teacher should always be ready to teach. Okay. And when it comes to grandma's health, grandma's health. Okay, so grandma's health is something when she is able to go out, when she is able to go out in the market, purchase vegetables, fruits, enjoy shopping. Okay, when she is able to visit the neighborhood properly. For her, for your grandmother, that is where she can state that she is feeling healthy. Why? Because she is physically healthy, she is mentally healthy, she is going and interacting with the community, and she is socializing as well when she is going and interacting with the neighborhood, right? So that is when your grandma can say that she is functioning well physically, mentally, and socially as well. Okay, so this is what we have discussed in the significance of health. Now the second thing that we have started discussing is about the personal and community issues, because it is not like if we are maintaining personal hygiene but the place or the society where you live is not hygiene, that is going to affect your health. Now you might be saying like thinking, why so? If I'm maintaining a personal hygiene, my society is not good, how can that have an impact on my health? You might be having this question, right? But this is very true. If you are maintaining personal hygiene and community issues or community hygiene is not maintained, then too the chances of falling ill becomes very high. Okay, but you are personally hygiene, as you are maintaining yourself, okay, as well as the place or the society where you're living, that is also hygiene, then you can say that you are living in a healthy environment. Unless and until these two criteria are not fulfilled, you cannot say that you're living in a, you can say you are living in a healthy environment. Okay, so now we have already discussed that health means a state of physical, mental, and social well-being, right? Because it cannot be something that each one of us can achieve entirely on our own. You cannot have a state of physical, mental, and social well-being alone, all alone, right? For that you need something, so we cannot have each of this all alone entirely. It is not depending on us. It depends on whom? It depends on society as well, because here we are maintaining a state of physical, mental, and social well-being, right? So the health of all organisms, they are going to depend on the surrounding as well as the environment where they are living. Okay, suppose an organism is living in an area and that area is not healthy for it, for that organism, so उसका वो ऑर्गेनिज्म का हेल्थ टोटली किस पर डिपेंड कर रहा है, उसके सराउंडिंग पे, where that organism is living or the environment where it is living. Okay, now this environment, it includes the physical environment as well. If I'm talking about myself, I'm also a living organism, right? So my environment is going to include my physical environment as well, right? For example, health is at risk in cyclone in many ways. I have already informed you this about this, that if there is a natural disaster which is taking place, it is not only the natural disaster that is affecting the people. No, वो तो आके चला गया, but after that natural disaster, the chances of falling ill, the chances of transmission of diseases, it becomes higher. Okay, like covid में कैसे you were seeing that each and every people, the second people that you're meeting has been affected with covid, right? Why is it so? Because पूरा society जो है, if one is having certain disease and if that person is not taking care, and if that disease is infectious or a communicable disease, then it is going to spread rapidly, right? तो साइक्लोन आने के बाद भी ऐसा क्या होता है, बिकॉज देयर इज अ फ्लड. नाउ इमेजिन अ साइक्लोन है, फ्लड है, तो वहां पे लोग नहीं देखते ना दैट दिस पर्सन इज हैविंग अ डिजीज. ऑल दे वांट इज टू सेव देयर लाइफ. एंड अगर फ्लड आया है, वाटर के थ्रू कितने सारे डिजीजेस ट्रांसमिट हो जाएंगे एक जगह से दूसरी जगह पे, राइट? साइक्लोन आ रहा है, एयर से कितने सारे डिजीजेस स्प्रेड हो जाएंगे. सो वेन एवर देर इज अ नेचुरल डिजास्टर और कोई भी डिजास्टर हो, मैन मेड डिजास्टर हो, it is going to have an effect on health as well. Okay, now see, human beings, they live in societies and our social environment is a very important factor in our you can say individual health. ठीक है, किस पे इम्पैक्ट देता है ये? हमारा जो सोशल एनवायरनमेंट है, हम जहाँ पे रह रहे हैं, दैट इज अ वेरी इंपॉर्टेंट फैक्टर फॉर मेंटेनिंग आवर इंडिविजुअल हेल्थ एज वेल. ओके, So some of us, we are living in villages, some of us are living in towns, cities, right? So in such places, what happens, our physical environment is also decided by our social environment itself. Okay, now consider what will happen if there is no agency. If there is no agency who is coming and collecting the garbage that you are throwing, and what is happening, the garbage has not been collected, neither it has been disposed. ठीक है, तो क्या होगा, वहां से बैड ओडर आएगा, बहुत बैड स्मेल आएगा वो गार्बेज से, बिकॉज दैट गार्बेज में वहाँ पे फिर फंगल ग्रोथ होगा, एंड देन पीपल विल स्टार्ट गेटिंग डिजीजेस, वो बैड स्मेल की वजह से पीपल विल स्टार्ट सफरिंग फ्रॉम one or the other symptoms, starts people starts vomiting, right? There will be many things that is going to happen. So what will happen if no one is taking the responsibility for clearing the drains and ensuring that the water does not collect in the street or the open spaces? Now mostly this thing occurs during the rainy season. We all know that on the road there are many holes which are present, and during rainy season what happens, the water gets collected on that hole, in that hole, right? तो उसके वजह से क्या होगा, during rainy season, this is the most case, आप देखोगे rainy season में malaria and dengue, the chances of getting malaria and dengue increases. Why? Because the chances of water getting stagnant at one place is very much high during rainy season, and if the water is getting stagnant at any place, mosquitoes are going to lay their eggs there in that water, and due to which you will see that the mosquitoes population will increase, and फिर क्या होगा, malaria and dengue the cycle is going to continue. So this is going to start the possibility of affecting the health of the people, and that is the reason the possibility of having poor health in that area increases, and therefore public cleanliness is very much important for individual health. It is not like that if I'm maintaining myself clean, that is not going to affect my health. सिर्फ खुद का health, if we are maintaining a personal hygiene and the environment or the surrounding where we are living, if that is not clean, then that is going to affect our health. It is going to lead to poor health conditions. Okay, now we need food to be healthy, and this food will have to be earned by doing work, right? But for this opportunity to do work has to be available. Now अगर हमें healthy रहना है, we have to eat a healthy diet, and for obtaining that healthy diet we need to find some work and earn. Okay, but this earning is not possible unless and until there is no opportunity to do work, right? So in order to be healthy we need to be happy as well. जैसे अभी healthy रहना है उसके लिए काम करना पड़ेगा, काम करने के लिए work opportunity होनी जरूरी है, right? So in order for you to be healthy you need to be happy as well. If you are healthy but you're not happy, then that is going to like affect your health. And if we mistreat each other, अगर आप किसी को mistreat करते हो, even that person is not healthy, neither you are healthy, right? So if we are mistreating each other and if we are afraid of each other, we cannot be healthy or we cannot be happy at such time. Okay, after this scene we have studied this 5 F's. What is to be done, what is the hygienic condition that we need to maintain, and what is the sanitization that need to be maintained. Okay, so social equality and harmony, these are therefore very much necessary for individual health. ठीक है, अब अपने अपने हेल्थ के लिए अभी अगर सिर्फ आप अपने बारे में सोचते हो, यू डोंट केयर व्हाट द सोसाइटी इज डूइंग, व्हाट कम्युनिटी इज डूइंग, व्हाट दे आर suffering from, so that is not a healthy attitude that we are having, because इंडिविजुअल हेल्थ के लिए हमारा सोशल इक्वालिटी एंड हार्मनी, दैट इज वेरी मच important and necessary so that we can maintain our individual health. Okay, now we can think of many other such examples of connections that is existing between the community issue as well as the individual health. Now what are the 5 F's? So see, first is the fluid. Now whatever fluid that we are taking in, we need to protect the water source, and what is the sanitization which needs to be done? We need to treat and store that water safely. This is the sanitization. Okay, fluid के बाद we have fingers. Now whenever you are washing your you are going to washroom, you need to wash your hands after defecation. Okay, क्या करना है? You need to wash your hand after defecation, and washing hand before preparing and taking the food is also very much important. Okay, after that, flies. So what you need to do is you need to cover the food and you need to control the flies. Okay. Then the fourth F is fields. Now we know that agricultural fields are there, and agricultural field mein when you go to villages and in some part of your areas, you will see that people don't have toilets. So what are they doing? They are going and they are going and like, since they are not having washrooms and toilets, they are going early morning in the agricultural field, and they are using that agricultural field as a toilet, right? So whatever vegetables and fruits are being grown there, they can get affected because of that, right? So what is to be done is, whenever we are bringing vegetables and fruits from the market, we need to clean them properly, we need to wash them properly, and always we should avoid open defecation, because that is going to have an health effect on us. Because if, as I'm telling you, that हम खुद का health सिर्फ खुद को like hygienic रख के नहीं कर सकते. We need to maintain social hygiene as well. Okay. After that, the last step that we are having is of the flood. Now, for the flood should not occur. For that reason, we need to have a proper drainage system, because if there is no proper drainage system, the chances of having this floods will increase. Okay. And sanitization is, whatever drainage system ke through the proper has been the water has been coming, we need to treat that water. So treatment of water is also very much important. So these are the 5 important F's that we need to take care of. Okay. Now, after that, we discussed on what is the distinction between healthy and disease free. See, disease word जो है ना, it is self explanatory. Why? See, distinction between healthy and disease free. If this is what we mean by health, what do we mean by disease? Now you know, health means a complete state of being physically, mentally, and socially healthy, right? But what do you mean by disease? So, the word disease is actually self explanatory. We can think of it as disease, that is a disturbed ease, when you're not feeling good, when you're very much disturbed. Okay, so disease is nothing but it is called as disturbed ease. Okay, so disease, in other words, literally means being uncomfortable. Now, what does this disease word means? Being uncomfortable. Okay, however, the word is used in more limited meaning. Now, if you are feeling like vomiting or you're doing vomiting, okay, vomiting a headache, so you cannot tell that I'm suffering from a disease. No, because there is a this is used for a limited meaning only. Okay, in that case, when you are having vomiting, you cannot say that you are having disease. Okay, so that is why we use it in a more limited meaning. And we talk of disease when we can find a specific and a particular cause for discomfort. Now, discomfort क्या है? आपको vomiting हो रही है. This is the discomfort. So when you come to know or you find a specific and a particular cause why this vomiting is occurring, then you can say that I'm having this disease because of which I got this discomfort, that is vomiting. This is the symptom. Okay, so this does not mean that we have to know the absolute final cause. We can say that there is that someone is suffering from diarrhea without knowing exactly what has caused the loose motion. Now, diarrhea, you can say diarrhea is a disease. Okay, so you are saying that person is suffering from diarrhea. It means the person is having loose motion, but the person don't know what has caused the loose motion to him. Okay, so we can now easily see that it is possible to be in poor health without actually suffering from a particular disease, because if you are not mentally and physically in a good health, then you can say कि आप poor health में होगे, वो chances, that is all, there are chances of this as well, because you're not suffering from any of the particular disease, right? So simply not being diseased is not the same as being healthy. अगर आप disease नहीं है, आपको कोई भी disease नहीं है, it doesn't mean that you are healthy. Okay, so if I'm talking about a dancer, or a dancer, a good health will be if he or she is able to stretch his body into a difficult but graceful position. Then for that dancer, that is going to be the good health of that dancer. Okay, and if I talk about a good musician, the musician के लिए the good health will be having enough breathing capacity, where musician's lungs can control the notes from his or her fluid. So this is if you are able to do your work effectively without any glitch, without anything, without any disturbances, then you can say that you are healthy. Okay. So to have the opportunity to realize the unique potential in all of us is also necessary for real health. Now, we all are unique. I hope that you agree with this. We all are unique. We have some or the other unique potential within us which we need to identify, right? So, realizing your unique potential is also very much necessary for real health. Okay, so we can be in poor health without there being a simple cause in the form of an identifiable disease. Okay, हम poor health में भी हो सकते हैं. We don't know what is the cause of that. Without identifying this in the form of आपको पता नहीं है कि कौन सा disease है, still there will be some cause because of which you can be in poor health, because as I said that being disease free is nothing like that you are healthy. अगर आपको disease नहीं है तो I cannot say that you are healthy. Okay, so this is the reason why we think about health. जब भी आप health के बारे में हम discuss करेंगे, whenever we are discussing on health, we will be discussing about the societies and the communities. But when it comes to disease, we are only going to discuss on an individual sufferer. That individual sufferer is suffering from diarrhea. Okay, and there are many number of diseases which are there, so people can suffer from any. तो health आएगा तो वहाँ पे societies include होगी, communities include होंगे. When it comes to diseases, there we are going to think about the individual sufferers. Okay, now the next topic that we have discussed is disease and its causes. Now what do you think, what does the disease look like? See, now let us now think a little more about diseases. In first place, do you know how do we know that there is a disease? आपको कैसे पता चलता है कि आपको कोई disease हुआ है? Or in other words, if I say, how do we know that there is something wrong with the body? Okay, that is because of the tissues which are present in our body, and you know the different types of tissues which we have studied in our earlier lessons, right? So these tissues, they are going to make some physiological system. We all know that हमारी पूरी human body is made up of cells, right? And when a group of cells having the same structure and function, they come together, they make up the tissue. Okay? And when a group of tissue having the same function, having the same structure and the function together, when they come up, they form the organ system. Okay? So now this organ system, they have specific function to perform, right? So when it comes to the digestive system, now our digestive system, it includes the stomach and intestines, means small intestine and large intestine, and our digestive system is going to help us in digesting the food that we are taking it from outside the body, right? So we have a digestive system that is performing its function of digestion. Then we have musculoskeletal system. Now this musculoskeletal system is made up of bones and muscles. किससे बना हुआ है ये? Bones and muscles से. So now this musculoskeletal system is going to hold the body part together and is going to help the body move. What it is going to do? Musculoskeletal system is going to hold the body part together and is going to help our body move. But when there is something disturbing, or what if these systems are disturbed, the functions will not be performed properly, right? And then we come to know that these are the symptoms. It means that I might be having some kind of disease, right? So when there is a disease, either the functioning of one or more system of the body will change for the worse. What will happen if there is a disease which is being there to you? What is going to happen? One or more system of your body, the function of one or more system is going to change, and because they are not able to perform their function, the changes are going to become worse, and this changes which is occurring in our organ system, because of which they are not able to perform their function, these changes are going to give rise to symptoms and signs of disease. Okay, and when you see the symptoms of diseases, symptoms are nothing but the things we feel as been wrong. Okay, what are symptoms? Symptoms of disease are the things we feel as being wrong. Okay, so we have a headache, we have cough, we have loose motions, we have a wound with pus. These are all symptoms of disease. What are they? These are all symptoms of disease, and these symptoms, they are going to indicate that there may be a disease, but they don't indicate what the disease is. Now you come to know that my body is suffering from loose motion, I'm having cough, I'm having headache. Okay, so these are all symptoms of the body, but you don't come to know that what exactly has caused the symptoms, and that is the reason. What are you going to do when you have such symptoms? You go and visit a physician, or you go and visit a doctor. Right now, the doctor is going to find out the sign why it is occurring. Okay, so for example, a headache may mean just examination stress. We all know that when we have our exams, what happens? बहुत ज़्यादा stress लेते हैं हम, because of which we have examination stress, and that leads to headache. Then very rarely it may also mean meningitis if there is no stress, and then too we are having headache. Then rarely it may mean that the person is suffering from this meningitis, or there are dozens of different diseases, and we are not responsible for identifying this disease. We just simply go to doctors, and doctors are going to find out the reason why the headache is occurring, right? So signs of diseases are what physicians will look for. So symptoms, you come to know about the symptoms of your body or the symptoms of the disease, and signs will be found out by the physicians on the basis of the symptoms that you're telling the physician. Okay, so signs will give a little more definite indication of the presence of particular disease. अभी जो signs दिखेंगे, like the physician is going to come out with different signs. So now this signs which the physician come to know, it give rise to a much more defined indication whether there is an absence or presence of a particular disease, right? And the physician is not going to just tell it to you like this. The physician is going to have a blood test, have any different kinds of lab tests to be done, x-rays to be done, and many different things, right? So the physician will get you a lab test done, and then only the physician is going to pinpoint the disease further, that yes, you are suffering from this disease, and this is the medication that you need to follow, these are the medicines that you need to eat, these are the things that you need to stop eating, right? These are the different suggestions which have been given by our physician when we visit them. Now, next thing that we have studied is about the acute and the chronic diseases. Okay. Now, whatever manifestations of the disease are there, they are going to be different. How? Why? How and why they are going to be different? Because they will be different because this depends upon number of factors. There are different number of factors on which it depends on, right? So some diseases, they last only for a very short period of time, and we call these diseases as acute diseases. Now we हमें पता है when we all have experienced common cold, right? Common cold is something that gets cured within 2 to 3 days or within a week, right? So the diseases or the symptoms that last only for a short period of time, we call that disease as acute disease. But we are aware of chronic disease as well, the disease which lasts for a very long time and even for a lifetime, right? So those diseases are called as chronic diseases. And the example which has been given here of chronic disease is infection causing elephantiasis. Now I hope you have heard about the term elephantiasis. What exactly it is? Elephantiasis में क्या होता है? You might have seen some people, उनका leg जो है that becomes the size of the elephant. So that is what we call as elephantiasis. This is an infection, okay, and this is very much common in some part of India, and this is what is a chronic disease that can even last for a lifetime, okay. Now, how this chronic disease can lead to poor health? See, acute and chronic diseases, they have a different effects on our body, and any disease that is causing this poor functioning, as I told you, the digestive system is going to get involved in the digestion. It is going to function performing the digestion of the body, right? So any disease that is causing the poor functioning of some part of the body, it is going to affect our health because our functions are not being performed properly, right? So that is going to affect our health, and this is going to be because all functions of the body, they are necessary for being healthy. अभी बॉडी में जितने भी फंक्शंस परफॉर्म हो रहे हैं, दिस ऑल फंक्शंस आर नेसेसरी because we need to be healthy. So for being healthy, all the functions that our body is performing, that should be good, right? But an acute disease which is over very soon. Now, as I have given you an example of cold and cough, right? Cold and cough is associated with acute disease. So acute disease is not going to last for a long time. It lasts only for a short time and it gets over very soon, right? So this acute disease is not going to have time that it can cause major effect on the journal health, right? Because it is not having that much of time. It is not it will not be there for a major time, right? And that is the reason it is not going to affect our journal health much. While because the chronic disease is having a longer effect on our functioning of our body, it is going to have an effect on us. Okay. So as an example, think about cold and cough, which all of us have from time to time, right? And most of us, we get better and become well within a week or so. We don't have cough and cold which lasts longer than a week, right? And there are no lasting effects on our health. अगर cold and cough अगर आपको हो रहा है, you are cured within a week, and there is no other effect which is seen on your health, right? But if we get infected with a chronic disease such as tuberculosis of the lung, now after elephantiasis, the second example you can remember is of tuberculosis. Okay. Now, tuberculosis of the lung is a chronic disease because it lasts for a longer time as well as it can even last for a lifetime, right? So then being ill over the years does make us lose weight and feel tired all the time because you're suffering from disease. Your body's function has not been performed properly, because of which you're going to lose the weight. Because tuberculosis का एक symptom ये भी है that people lose weight during tuberculosis. So as there is a weight loss, the person will feel tired all the time. The person will not go to school, will not go to office for a few days. See, when you get cold and cough, you don't go to school for a few days, right? Because you know that you will be good in 2 to 3 days, so you don't go because that spreads as well. But a chronic disease will make it difficult for us to follow what has been taught in school, and it will reduce our ability to learn as well. अगर किसी को chronic disease है, see, whenever your body is suffering from something, you know what, it becomes very much difficult for our body to cope up with the differences that it is finding at that time, because there are changes which have been seen in your body which should not occur, right? तो हमारे body को उस वक्त परफॉर्म करना थोड़ा डिफिकल्ट हो जाता है खुद के लिए, एंड दैट इज द रीजन व्हाट हैपेंस, वो अलग अलग चीज़ों को एडजस्ट करना चालू करता है वेर इट इज प्रिपेयरिंग इटसेल्फ. ओके, सो यहाँ पे क्या होगा, अगर किसी को ट्यूबरकुलोसिस है या किसी को कोई क्रोनिक डिजीज है विच इज लास्टिंग फॉर लॉन्ग टर्म, सो वहाँ पे उसके बॉडी का फंक्शन तो इफेक्ट हो रहा है, साथ में ही एज आई टोल्ड यू दैट the person will be feeling tired all the time, so it is going to reduce the person's ability to learn as well. Okay, in other words, we are likely to have prolonged journal poor health if we have a chronic disease. अगर किसी को भी chronic disease है, that person is going to have a journal poor health, prolonged journal poor health. Okay, so chronic diseases therefore they have a very drastic long term effect on people's health as compared to acute disease. अब acute disease से compare करोगे chronic disease को, तो ज़्यादा effect इसका है acute disease का या chronic disease का? Yes, chronic disease का impact ज़्यादा होता है हमारे body पे, and that is why chronic disease it leads to poor health. Okay. Now, next thing that we have discussed on is what causes these diseases. And when we think about the causes of disease, see, we must always remember that there are many levels which is called of such causes. Whatever causes we find for these diseases, there are many different levels of such causes. Okay, so let us look at an example. If there is a baby who is suffering from loose motion, okay, now what do you think? Why the baby is suffering from loose motion? So that is probably because the baby had an infection because of poor immunity, you can say, right? But the next question that we can come up, I'm telling you that the baby is suffering from loose motion, that is because of an infection. But now you should have in your mind, the question that you should have in your mind is, what is causing this infection in the baby? So suppose we find out that the infection came through unclean drinking water. How does the infection came through? Through the unclean drinking water. But here there were many babies who might have that unclean drinking water. So why that only one baby has developed loose motion and why the other babies have not developed loose motion? So one reason here is the baby who is suffering from this loose motion might be because the baby is not healthy. ठीक है. If the immunity is good, the person or the baby is going to have a good immunity and it can fight against the disease or any of the bacteria and infection. But if the immunity is not good, then there are chances that the person is not going to be healthy because the infection and you can say the diseases can occur very quickly in their body, and this is the only reason that baby got infection while the others did not. Okay, so I hope that I'm very much clear with it. Now, the next thing that we have after causes of disease. Now, see, as the baby was suffering from the infection because it was not healthy, as a result, it might be more likely to have disease when exposed to risk, whereas healthier babies will not. If the baby is not healthy, then the chances of getting more and more diseases has increased in that baby. But if the baby is healthy, then the chances of getting disease is not that much. Okay, so why is this baby not healthy? What do you think? Why is this baby not healthy? Because there are chances that the baby is not well nourished and the baby doesn't get enough food. So we can say at the end that lack of good nourishment, that is the second cause of the disease. The first cause of the disease was infection. The second cause of disease is lack of good nourishment because the baby is not getting properly nourished. The baby is not getting the proper nutrients which have been needed by the body of the baby. That can also lead to the second cause of the disease. Further, there comes a question that why the baby is not well nourished, because the baby comes from a house which is poor. So in that case, this is one of the possibility. This is one of the possibility, and it is also possible that the baby might have some genetic differences. Now, genetic differences, when it comes to genetic differences, here we can have like DNA and RNA. DNA stands for deoxyribose nucleic acid and RNA stands for ribose nucleic acid. So when there is a genetic difference which occurs in the baby, that can also lead to like the baby can suffer from diseases because of this genetic differences, or whenever it is exposed to a pathogen because it is having a genetic difference, and or might be the second reason might be that because it is not properly nourished, the chances of getting diseases to the baby increases here. Okay, so without pathogen, the genetic difference or poor nourishment alone will not lead to loose motion. Now, if in this case, as we discussed that the baby was suffering from loose motion because of the because of the water, right? Because of the unclean water that the baby had drunk, right? So यहाँ पे because from that water the pathogen might have entered the baby's stomach, because of which it has lead to an infection. So if there is a genetic difference, unless and until the pathogen is coming in contact with that like the pathogen is not coming in the contact of the baby's body, it is not going to have any of the disease. So pathogen is one of the main cause, okay, but they do not become the contributory cause of the disease. Now this pathogen is not the contributory cause of the disease. And here one more question comes is, why was there no clean drinking water for the baby? Because the public services where the baby is been born, or where the family is living, the public service with respect to water is not good. They're very much poor. So poverty or lack of public service, this is the third cause of the baby's disease. The first cause was infection, second cause is the lack of good nourishment, and the third cause is poverty or lack of public services. Okay, and it will now be obvious that all the disease will have an immediate cause and contributory cause, right? We all know whenever there is a disease which occurs, the disease is going to have an immediate cause and a contributory cause. And most of the disease, they have causes rather than a single cause. Now there are many causes which a disease has. Rather than only having a single cause, there are many different causes because of which the disease occurs. Okay. So I want you all to write the three causes that we have discussed here. The first cause was infection. Second is lack of good nourishment, and the third one is lack of public service. These are the three reasons. Okay. Now the next thing that we have is infectious and non-infectious causes. Now अभी तक हमने जो भी पढ़ा है, you might be clear with it that it is very much important to keep public health and community health factors in mind when we think about the causes of disease. Any of the cause of disease, कि कोई भी causes के बारे में when we are thinking about, it is very important that we think about the public health and community health factor as well, because our individual health not only depends on personal hygiene, it also depends upon the social health and the community health, right? So can we take that approach a little further by thinking it that it is very much useful to think of immediate cause of disease as belonging to two distinct types, right? See, abhi after this COVID, now people are very much aware of different factors that is causing health in them. People are maintaining hygiene, not only personal hygiene but also community hygiene is also well maintained because of COVID. COVID has given a negative impact, but there are some positive impact as well which has taken place, right? So here we can like instead of thinking of disease, why not have an immediate cause? Why not think of the immediate cause that the disease is giving, right? So one group of cause is the infectious agent. Okay, first एक group क्या है, one group of cause is the infectious agent, and this infectious agent it mostly includes the microbes, which we also call them as microorganism. Okay, now diseases where microbes are the immediate cause, they are called infectious disease. अब जो disease को microbes ने cause किया है और because of the growth of the microorganisms the disease has occurred, we call that diseases as infectious disease. Okay, now this is infectious because the microbes they can spread in the community, and the diseases they cause will spread with them. Now why do we call them as infectious disease? Because ये microbes जो है वो हमारे पूरे community में बहुत जल्दी spread हो जाएंगे, as well as the disease which occurs because of this microbe, that is also going to get caused very much quickly, right? On the other hand, there are also diseases that are not caused by infectious agents. Now भी ऐसे बहुत सारे diseases हैं which doesn't spread, or they are not been caused by any of the infectious agent like microbes or microorganisms. Okay, so here the causes vary with respect to infectious and non-infectious cause, but they are not an external cause like microbes that can spread in the community. Now this when it comes to non-infectious causes, non-infectious cause is not the microbes or the microorganism. The cause is going to be mostly internal. For example, some cancers are caused by genetic abnormalities, right? Abhi genetic abnormality is not an external cause, right? Because genetic abnormalities to हमारे body के अंदर हो रहा है, right? So that is an internal cause, that is genetic abnormalities which leads to cancer. Some cancers are been caused because of this genetic abnormalities, right? Then high blood pressure can be caused by excessive weight and lack of exercise. If I'm not exercising, if I'm having excessive weight, then what can happen? It can lead to high blood pressure. High blood pressure can lead to heart attack, heart failure, anything heart related diseases, right? So you can think of many other diseases where the immediate cause will not be infectious. If someone is having high blood pressure, that is not going to spread among the community, right? Because that is with respect to that individual person, है ना, वो spread नहीं होगा. And this type of disease we call it as non-infectious disease. Okay, now the way in which the disease is spread and the way in which they can be treated and prevented at the community level, it will be different for different diseases. अब जो भी डिजीज है वो कैसे स्प्रेड हो रहा है, वो डिजीज को हम कैसे ट्रीट कर रहे हैं, उसको कैसे प्रिवेंट कर रहे हैं एट कम्युनिटी लेवल, that is going to vary with respect to different diseases. Okay, so this will happen a lot on whether the immediate cause are infectious or non-infectious. Now how are we treating those disease totally depends upon whether that disease is infectious or whether that disease is non-infectious. Now COVID में क्या हुआ था, COVID was spreading rapidly among the community, so COVID was an infectious disease, and उसको prevent करने का तरीका तो आप सबको पता है how we were dealing with COVID. Everyone, whenever they were coming from outside, proper sanitization was done, proper washing of the vegetables, fruits were done, right? Ekdam, you can say the hygiene was so much well maintained that disease cannot occur in that situation. So दिस इज अ पॉजिटिव इम्पैक्ट दैट हैज गिवन. एक तरह से पर्सनल हाइजीन को बहुत ज़्यादा प्रमोट किया गया था ड्यूरिंग कोविड, राइट? पूरा सैनिटाइज किया जा रहा था. द प्लेसेस वेयर यू वर गोइंग, दैट प्लेसेस वर क्लीन, दे वर kept like they were cleaned every half an hour, every 1 hour, because people were visiting there. The railway platforms, they were clean, the trains were clean, everything cleanliness was maintained, because that was an infectious disease which was spreading just by a touch as well, right? And that is why a proper prevention was kept. Now these are some of the pictures which is showing us about the infectious disease. Can you see the first picture? It is showing us smallpox. Second picture is showing us measles. Third picture is showing us herpes, and the fourth one is showing us swine flu. Now, how can you identify that is swine flu? What is that picture indicating? You know, swine flu, it spreads through pig, through an infectious pig. Okay, you can have a detailed study on swine flu if you want, because ये बहुत ज़्यादा स्प्रेड हुआ था. एंड यू नो, जैसे आपको कोविड के लिए एवरीथिंग वेंट ऑनलाइन, यू हैड सो मच डेज ऑफ हॉलीडेज, योर एग्जाम्स वर कैंसल्ड. सो वी वर नॉट दैट मच लकी कि हमारे एग्जाम्स तो कैंसिल नहीं हुआ, बट वी गॉट हॉलीडेज 15 to 20 days, because there was a rapid spread of swine flu when I was in I guess 9th or 10th itself. तो swine flu उस वक्त बड़ा था बहुत ज़्यादा, and it spreads from pigs, and many people they eat pigs. If you are aware of, pigs are also eaten by people, है ना? तो ये बहुत रैपिडली स्प्रेड हो रहा था. स्वाइन फ्लू इज एन इन्फेक्शियस डिजीज, रिमेंबर दिस थिंग. Now we are going to discuss on infectious disease, but when it comes to infectious disease, knowing about the infectious agents are very much important, right? So we have seen that the entire diversity which is seen in the living world can be classified into a few group. अभी जो पूरी की पूरी diversity है हमारे living world में, diversity मतलब वेरिएशन जो है हमारे लिविंग वर्ल्ड में, उसको हम क्लासीफाई कर सकते हैं अलग अलग ग्रुप्स में. वी कैन मेक सर्टेन ग्रुप्स, ओके? एंड दिस क्लासिफिकेशन, व्हेन वी आर क्लासिफाइंग द एंटायर डाइवर्सिटी, इज बेस्ड ऑन कॉमन कैरेक्टरिस्टिक्स बिटवीन डिफरेंट ऑर्गेनिज्म. ठीक है, अलग अलग ऑर्गेनिजम्स के बीच में कुछ कॉमन कैरेक्टरिस्टिक्स है, एंड बेस्ड ऑन दिस कॉमन कैरेक्टरिस्टिक्स we have this classification which has been done. Okay, so the organisms that cause disease, they are found in wide range. अब ऐसे organisms जो disease spread कर रहे हैं, who are causing the disease, they are found in very wide range, and they have like उनका classification का category is also very wide. Okay, so some of them can be virus, some can be bacteria, some can be fungi, some can be single-celled animals or protozoans, like you have seen in this picture. Is this 13.1? Yeah. So let's discuss on this. Now this is the picture, microscopic picture of SARS, SARS, okay? SARS virus, which is coming out from the arrow. Can you see SARS virus, how it is coming out? So coming out of the surface of an infected cell. Now a person who was infected with the SARS, we have taken the cell and we have done a microscopic, like scientists have done that. So उन्होंने क्या किया है, infected cell लिया है, and this is how the picture of the SARS virus look like. So the wide scale line, can you see the wide scale line? It represents 500 nanometer, which is half a micrometer, and which is 1000 of a millimeter. Okay, so the scale line gives an idea of how small the things we are looking at are. Now this, ये जो cell है microscopic cell, the cell है, जब उसको microscopic देखेंगे, the SARS are very much minute, and 500 nanometer means 500 nanometer is half a micrometer. एक micrometer का half, जितना इतना छोटा बहुत छोटा है वो, ठीक है, बहुत छोटा है. Now even because it has taken the picture like that, you can see that it's a big structure, but no, इसका size इतना ज़्यादा बड़ा नहीं है. Okay, and courtesy, this picture is taken, courtesy means from where the picture is taken. Okay, so it is taken from Emerging Infectious Disease, that is a journal of CDC US. Okay, now the second picture which you can see is a picture of Staphylococci, the bacteria which causes acne. Now we all know acne means pimples and all. Okay, so ऐसा दिखता है ये अंडर माइक्रोस्कोपिक. अभी आप अगर ये स्टाफाइलोकोकाई ऑब्जर्व करोगे, बैक्टीरिया ऑब्जर्व करोगे माइक्रोस्कोप के अंदर, so you will see that it occurs like this and it causes acne, and the scale of the image is being indicated by a line at a top left. Can you see the line at the top left? So that is 5 micrometer long. How much? 5 micrometer long. Okay, and the third picture is the picture of trypanosoma. Okay, now trypanosoma is a protozoan. Can you see? We discussed on a virus, we discussed on a bacteria, and now it's the protozoan organism. And this protozoan organism has been responsible, that is troposoma, is responsible for slipping sickness. Okay, so the organism is lying next to a saucer-shaped red blood cell to give an idea of the scale. Now, this is the red blood cell, and this is the organism which is lying here just beside the red blood cell, okay, and it gives us the idea of the scale. तो red blood cell का size जो है उससे बड़ा है ये trypanosoma, which is a protozoan which leads to slipping sickness. Okay, and this is a copyright from an Oregon Health and Science University, US. This is the courtesy, that is the place from which the picture has been taken, because these are you can say these are the hard work of certain people, so we cannot use them directly. Okay, and that is the reason we are not using it directly, and that is why courtesy and the source has been given from where the pictures are taken. Okay, now the next picture that we have is picture of leishmania. Now leishmania is again a protozoan organism which causes kala azar. Okay, this is how leishmania looks like under the cell, under the microscope. Okay, so the organism, that is leishmania, they are oval shaped and each one has one long whip-like structure. Can you see? This is a long whip-like structure. Okay, and one organism, that is the arrow, this is an organism, is dividing, while a cell of the immune system which is at the lower right has gripped on the two whips of the dividing organism and is sending cell processes up to eat up the organism. So यहाँ पे नीचे क्या है? At the down side, lower right पे we have a cell of immune system जो क्या कर रहा है वो it is gripping the two webs of this dividing organism and it is sending the cell processes there so that the cell processes it can eat up the organism. Okay, so यहाँ पे जो हमारा immune cell है that is about 10 micrometers in diameter. ठीक है, immune cell का size कितना है? Immune cell is about 10 micrometer in diameter. And the next picture that we have is an picture of an adult roundworm. किसका picture है? Adult roundworm का picture है, that is Ascaris lumbricoides from the small intestine. Now this roundworm has been formed in the small intestine, which is called as Ascaris lumbricoides. Okay, so the ruler next to it shows 4 centimeter to give us an idea of the scale. Okay, so this is how large the, you can say, organism is. Okay, so some diseases, they are caused by multicellular organisms such as worms of different kinds. So now let us see. Now common examples of diseases which are caused by viruses, they are common cold, influenza, dengue fever and AIDS. So the disease which are spread by viruses are common cold, influenza, dengue fever and AIDS. Okay, and diseases like typhoid fever, cholera, tuberculosis and anthrax, they have been caused by bacteria. And many of the common skin infections, they are caused by different kinds of fungi. Protozoan microbes, they cause many familiar diseases such as malaria and kala azar. Okay, and all of us have come across the intestinal worm infection as well as diseases like elephantiasis, which are caused by different species of the worms. Now these are very much important that you should know the name of the diseases which are being spread by viruses, bacteria, fungi, protozoans. Okay, so I want you all to take a note of all the things, of all the diseases, how are they being spread. Okay, now why is it important that we think of these categories of infectious agent? Why we are thinking on the categorization here? So the answer is that these categories are important factor because we are going to decide on what kind of treatment are to be given when certain diseases occur, because we treat the categories here, because on the basis of the categories only we are going to find out, or we are going to come up with the kind of treatment we need to use, right? So each of members of each one of this group, whether it is virus, bacteria, fungi, protozoan, they have some biological characteristics in common. Okay, that is, for Viruses, for example, viruses live inside the host cell, whereas bacteria very rarely do. Bacteria don't live. It is very much rare that bacteria live inside the host cell. Okay. Then the viruses, bacteria, and fungi, they multiply very quickly, while the worms, they are going to multiply very slowly. ठीक है, बैक्टीरिया जो है वो फास्ट मल्टीप्लाई करते हैं, बैक्टीरिया, वायरसेस एंड फंगाई, बट द worms they multiply very slowly. Okay, and taxonomically if we see, all the bacteria they are closely related to each other, then to viruses and vice versa. This means that many important life processes in one member of the group is likely to be shared against many other of the group. So abhi Sorry, I just read the wrong sentence. This means that many important life processes, they are similar in bacteria group but they are not shared with the virus group. ठीक है, bacteria की group में वही bacteria group, if I am telling, it means there are many different kinds of bacteria that comes here, right? So bacteria की group में there are some life processes which are very much important and similar, whereas when it comes to virus group it is not the same. And as a result, drugs are going to block one of this life process in one member of the group, and that is the reason it is going to show its effect against many other members of the group. Okay, but the same drug is not going to work here against a microbe which is belonging to a different group. And as an example, let us take an antibiotic. Okay, antibiotic is something that kills the bacteria. Okay, so the commonly block antibiotics are going to commonly block the biochemical pathway which is important for bacteria. So many bacteria, for example, make a cell wall to protect themselves. Bacteria क्या करते हैं, वो एक सेल वॉल प्रिपेयर करते हैं खुद के लिए ताकि they can protect themselves. So the antibiotic penicillin is going to block the bacterial processes that are building the cell wall. ओके, तो वो जाके एंटीबायोटिक पेनिसिलिन वो जाके ऐसे बैक्टीरियल प्रोसेस को ब्लॉक करेंगे ताकि उनका सेल वॉल ही ना बन पाए, बिकॉज सेल वॉल नहीं है तो दे आर नॉट प्रोटेक्टेड, राइट? एंड एज अ रिजल्ट द ग्रोइंग बैक्टीरिया इज गोइंग टू बिकम अनेबल टू मेक द सेल वॉल एंड इट इज गोइंग टू डाई ऑफ इजीली. Okay, so human cells, they don't make a cell wall anyway. We don't make any cell wall, so penicillin cannot have such effect on us, and that is why you might have seen कि बहुत ज़्यादा penicillin use करते हैं लोग, right? Because penicillin will have this effect on any bacteria that use such processes for making the cell wall, and similarly you will see that many antibiotics are going to work against many species of bacteria rather than simply working against one. But this viruses, they are not going to use the same pathway at all, because the reason is why the antibiotic don't work against viral infection. See, if we are having a common cold, taking antibiotic is not going to reduce the severity or the duration of the disease. Okay, but if I am having a bacterial infection along with a viral cold, then if I am taking a antibiotic, that is going to help me, because antibiotics are going to kill the, like, they are going to break the cell wall, because of which वो bacteria जो है that is going to die. So if I'm having a bacterial infection, then only antibiotics are going to help me out. Okay, even then antibiotics will work only against the bacterial part of the infection, not the viral infection. अगर मुझे viral infection है and if I'm taking an antibiotic, is not going to help me, because I take antibiotics for bacterial infection. Okay, so I hope you're clear till here. Now in the next class we are going to start with the means of spread. After that we will be discussing on organ specific and tissue specific manifestations in detail, and after that we are going to discuss on two important principles, that is principles of treatment, and the next thing is principles of prevention. Okay, so these are the two important principles that we are going to discuss at the end, and at the end we have immunization to discuss, because this is very much important when it comes to diseases and illness, immunization power. Okay, so this is the last topic that we will be covering for this lesson, why do we fall ill. After immunization, we are going to discuss the whole lesson in short, that is a summary discussion on the whole lesson. We will be discussing it, and then we have certain exercise questions to discuss on at the end. Let me show you the questions. Okay, we have 6 questions, I guess. We will be discussing that at the end of this lesson, why do we fall ill. Please go through the questions one by one. Now you will get a chance to do a survey as well. suggest you go and do that, because it gives you, you can say, it gives you an extra knowledge with where you will be discussing, you will be coming in contact with different people, and you will be gaining knowledge. Okay, so it is not taking anything from you, but it is giving you something. It is just going to take your time, nothing else. Okay, so these are the six questions that we are going to discuss at the end of the lesson. Why do we fall ill? And I hope that whatever we have discussed in this part, you're very much clear and thorough with it. So the rest of the part which has been left, we will be covering that in the next part. Thank you, everyone.